Good afternoon, Bahamas, and thank you again for joining us for the Ministry of Health's COVID-19 update. As is usual, we will begin with our Minister, followed by myself. Minister?
Good afternoon, Bahamas. Here is the latest national COVID-19 report. On Thursday, the 22nd of July, 2021, there were 110 newly confirmed cases of COVID-19. This brings the total number of confirmed cases in the Bahamas to some 13,957. Currently, there are 23 moderately ill COVID-19 patients hospitalized in Grand Bahama Healthcare Services, and there are 2 patients currently receiving intensive care in Grand Bahama. Here in New Providence, there are 20 hospitalized COVID-19 patients at Doctors Hospital. 13 are moderately ill, and 7 are currently in the intensive care unit. There are 7 moderately ill COVID-19 patients being treated at the South Beach Acute Care Referral Center. At Princess Margaret Hospital, there are 39 COVID-19 patients. 38 are moderately ill, and 1 patient is receiving care in ICU. 1 person is also moderately ill at the Sandens Rehabilitation Center. In all, there are 1,351 active cases of COVID-19 in country. 24 persons have been recently classified as recovered from COVID-19. This brings the total number of recoveries from COVID-19 to some 12,238 persons, for a recovery rate of 87.68%. My brothers and sisters, unfortunately, a 50-year-old female from New Providence died yesterday. This brings the total number of confirmed COVID-19 deaths to 280 persons. 23 deaths remain under investigation. 1 COVID-19 death to us in the Ministry of Health, as we continue to say, remains 1 too many. We continue to pray for the families in the Bahamas who have lost loved ones to this awful global COVID-19 pandemic. A total of 115,959 RT-PCR tests have been carried out for COVID-19 in country. 434 tests were performed yesterday, with 110 positives and 317 negatives. 7 tests were repeated to determine recoveries, and there were no inconclusive tests. Ladies and gentlemen, the Ministry of Health continues to monitor the increase in the number of confirmed COVID-19 cases and hospitalization. On the 17th of July, 2021, the Bahamas experienced 100 newly confirmed cases. This was a deja vu, not experienced since September of last year at the height of the second wave. Hospitalization in this third wave have been much higher than in the second wave for the Bahamas. In fact, on the 20th of July, 2021, the country experienced a peak in hospitalizations at 92. These excessive numbers have placed our public health system to the test, and our gallant and valiant healthcare workers continue to rise to meet this challenge. Currently, there are a total of 38 beds available on Grand Bahama for COVID-19 patients. At the Cancer Center of the Bahamas, there are 24 beds for COVID-19 patients with mild to moderate illness. At the isolation ward, also known as Med-Surg 3, there are 14 beds for acute COVID-19 patients. Ladies and gentlemen, On the other hand, in New Providence, the situation at Princess Margaret Hospital is much more critical. There are 6 wards closed to new admissions because of COVID-19 exposures. This has reduced bed capacity of PMH by some 96. Therefore, there are approximately only 32 beds currently being used for COVID-19 patients. 8 beds in the legacy unit and 27 beds in the special pathogens unit. You would recall that the special pathogens unit attends to only COVID-19 patients at this time. It consists of 3 tents with 9 beds that were handed over to the Bahamas government by Samaritan's Purse in the second wave. With increased numbers of COVID-19 and non-COVID-19 patients, PMH is currently running over its capacity to render our desired level of care and medical attention. Whilst there are no pediatric patients or children hospitalized with COVID-19 at this time, there is a continuous stream of COVID-19 patients ranging from ages 27 to 86 seeking medical attention. The majority of these patients are unvaccinated and are inevitably hospitalized. This has caused tremendous strain on our public healthcare system. The situation is compounded by the fact that a number of the nurses who are trained to care for COVID-19 patients have migrated to other countries with more lucrative compensation. Consequently, PMH has implemented several measures to manage the increase in COVID-19 patients presenting at the hospital. These include limiting the use of emergency department to emergency cases only, suspending outpatient laboratory service, elective surgeries, and in-person appointment at specialty clinics, not accepting telephone calls, the establishment of a WhatsApp text messaging system to fill prescriptions, a drop-off system for items such as drinks, non-perishable foods, and clothing, and reduce hours at specified clinics. On behalf of the government of the Bahamas, special thanks are extended to all nurses, doctors, emergency medical services, and other essential healthcare workers who have toiled and labored throughout this pandemic. We know you are exhausted from the effects of this pandemic. Please know this: we appreciate your continued dedication and devotion to caring for COVID-19 patients. Again, you make us proud to know that all frontline workers, healthcare workers, have embraced the collective vision to keep the Bahamas safe. My fellow Bahamians and residents, during this third wave of COVID-19 in the Bahamas, we have experienced a large number of COVID-19's deaths, unfortunately. When the third wave emerged in March, deaths stood at 180 from COVID-19. Since then, there has been some 100 deaths, so that the current death toll, again, now stands at 280 as of yesterday. The RAND laboratory, commonly referred to as the Morgue at PMH, can house some 73 deceased persons. However, today, it holds some 225 deceased persons. That is 3 times its capacity. Although 2 refrigerated containers are holding demised bodies outside the morgue, PMH can no longer and has no more space. Therefore, we strongly urge the general public to collect their loved ones at the morgue. The increased COVID-19 deaths have exacerbated the problem and placed additional strain on the resources of PMH's morgue. We entreat you to think of the family who has lost their loved ones recently and was not able to immediately entrust their loved one to an undertaker because an autopsy had to be performed. Please permit those families the use of the morgue for their loved ones so that they can bury them with dignity. The public is advised that if the deceased bodies are not claimed promptly, the government reserves the right to take legal action to remove and inter the unclaimed bodies to provide space for those who have recently passed away. Ladies and gentlemen, I know you have COVID fatigue. You're tired of wearing a mask, not hugging a close family member or friend, and staying home to prevent contracting the virus. However, we must remain disciplined. This global pandemic is not over as cases continue to rise globally and nationally. We need to be mindful that health measures are not punishment. They are for the safety and well-being of all of the Bahamian people and residents. Remember, the goal is to prevent the transmission of COVID-19 in our community. We want to save lives. The data consistently shows that when we actively apply the preventative measures, we slow down the spread of the transmission of COVID-19 in our communities. Again, we encourage you to continually stay 6 to 3 feet away from others, use hand sanitizers frequently, wash your hands often, keep hands away from eyes, nose, and mouth, wear a mask, and ensure all items purchased outside the home are sanitized before utilizing them. My brothers and sisters, we must not grow weary in doing well. For the good book says, in due season, we will reap a reward if we faint not. We entreat you to protect yourselves and your loved ones by following the public health measures. Ladies and gentlemen, the only way out of this pandemic is to be vaccinated. It is widely known that if we are vaccinated, we reduce the risk of severe illness from COVID-19, hospitalization, and death. Let us be clear. Taking the vaccine does not mean that you cannot get COVID-19. To do our part to reduce the rising number of cases, it is encouraged that persons still wear a mask. Not wearing a mask means that we throw caution to the wind and can possibly infect friends and loved ones, even if we are vaccinated. Again, vaccination reduces the risk of severe illness, hospitalization, and death. Increasingly, nearly all COVID-19 deaths in many countries around the globe, including the United States, occur when people are not vaccinated. The same trend is being reflected here in the Bahamas. We can stop the rising number of deaths in the country to practically zero if everyone eligible got vaccinated. Consequently, great efforts have been made by countries of the world to vaccinate their people. Globally, 29.8 million doses of vaccine are administered every day. So far, there are some 3.76 billion doses of COVID-19 vaccines that have been administered globally. 26.8% of the world's population received at least one dose of the COVID-19 vaccine. Some 13.4% of the global population is now fully vaccinated. In low-income countries, only 99.1% of the population has received at least one dose. Locally, as of the 18th of July, 2021, there have been some 101,466 vaccines administered. 60,360 have received at least one dose of the vaccine, and some 41,106 persons have been fully vaccinated in the Bahamas. The government is very pleased with its decision to select the AstraZeneca vaccine to assist the Bahamian people to get out of this pandemic. Unlike other vaccines, the AstraZeneca vaccine does not require a booster shot at this time. Recently, the Financial Times reported that if you got 2 doses of the Oxford AstraZeneca jab, you are likely to be protected against hospitalization with the Delta variant. Studies from England indicate that AstraZeneca has a 92% efficacy rate against the Delta variant. So we will continue to press to ensure that our young, elderly, and all eligible groups are fully vaccinated in the Bahamas. Let us remember, I got mine, you got yours. Get vaccinated. Ladies and gentlemen, to date, 3 Caribbean countries have donated vaccines to the Bahamas: Antigua and Barbuda, Montserrat, and Anguilla. Yesterday, on the 21st of July, 2021, some 3,496 doses of COVID-19 AstraZeneca vaccine was received from the British Overseas Territories of Montserrat and Anguilla with the assistance of the United Kingdom High Commissioner, Sarah Dickinson. These will be used to provide second doses to persons already partially vaccinated. The Ministry of Health received an update from PAHO that the 3rd tranche of vaccine through the COVAX facility is now expected to be in country by the first week in August. This represents some 33,600 doses of AstraZeneca vaccines. We are in discussion with the Caribbean Public Health Agency, CARPHA, about additional vaccines. This includes Johnson & Johnson vaccines from the African Medical Supplies Platform and an allocation of Pfizer vaccine from the United States to CARICOM countries, including the Bahamas. We are also expecting to receive the Pfizer vaccine allocated through the COVAX facility. All of these vaccines are expected to bring and to be in country, arriving as early as the first week in August. With the emergence of the COVID-19 variants in the United States of America, especially the Delta variant from India, the question continues to arise: are there COVID-19 variants present in the Bahamas? My fellow Bahamian and residents, remember, when a variant is of public concern, this means it can affect the transmissibility of the COVID-19 virus or affect the efficacy of the COVID-19 vaccine being administered. It is confirmed that COVID-19 variants are present in our communities. The National Reference Lab recently received results from 47 samples sent via PAHO to the Fiocruz laboratory in Rio de Janeiro, Brazil, for genetic sequencing. 34 samples collected during the period, the 13th of March to the 17th of April, were successfully sequenced. Of these 34 sequenced samples, 26% wore, actually 26 wore the UK variant of concern. One sample was the Iota variant of interest. This sequencing data correlates with the previously performed in-country PCR variant screening done at our national reference lab. The results confirms that the UK variant was in-country and is in-country, and current work is ongoing to determine whether the Delta variant is also present in our communities. Additional samples have been sent for sequencing, and we await the results. My brothers and sisters, during this third wave, the National Reference Lab has seen an uptick in the volume of COVID-19 samples collected. This has challenged the resources and staff of the National Reference Lab. Consequently, resident interns have been called to assist with the increased samples. Following the staff's return from quarantine last week, the lab is completely up to date with all of its samples and is once again processing results within a 24 to 36 hour time frame. Ladies and gentlemen, my brothers and sisters, based on the recommendations of our health professionals, the government of the Bahamas has decided to take the following measures as of Monday, the 26th of July, 2021 at 5 a.m. I'll say it again. Based on the recommendation of our health professionals, the government of the Bahamas has decided to take the following measures, which shall come into effect on Monday, the 26th of July, 2021 at 5 a.m. For New Providence, Grand Bahama, North and South Eleuthera, including Harbor Island, a curfew will be implemented between the hours of 10 p.m. to 5 a.m. RT-PCR tests will be required for travel from New Providence, Grand Bahama, North and South Eleuthera, including Harbor Island. This applies to persons who are not fully vaccinated. For New Providence and Grand Bahama, religious worship will be limited to 33% of occupancy capacity of the religious facility. Services are to be limited to 1 hour, and all safety guidelines of the Bahamas Christian Council are to be followed. In regards to funerals, no funeral or cremation services are permitted indoors, and funerals or burial services are to be held at the grave side only. Cremation services will only be permitted provided that they are held outdoors. A maximum of 30 persons are allowed at a funeral service. This excludes the officiant and the funeral workers at the funeral, burial, or cremation services. Repasses will not be permitted at this time. In regards to weddings, a maximum of 30 persons will be allowed to attend a wedding indoors or outdoors. This number excludes the officiant. Exercise groups are limited to 10 persons, and no group recreational or sporting activity is allowed at this time. Groups congregating on the beaches and parks should not be more than 5 persons. Professional athletes can continue to train, and maximum capacities at gyms and movie theaters are now set at 33%. In regards to restaurants and dining is restricted to outdoor and takeaway services, and it is encouraged that there be no loitering of groups outside restaurants or at the fish fry. These restrictions, however, do not apply to hotel properties. My brothers and sisters, no spas will be opened. This includes massages, waxing, threading, and facials. For all the islands of the Bahamas, private gatherings will be restricted to 5 persons, provided that those individuals are vaccinated. Lastly, my brothers and sisters, persons who are campaigning must be fully vaccinated, and campaigning teams are restricted to 5 persons. My brothers and sisters, in appreciation of the sanctity of life, let us continue to adhere to the public health precautions. Wear your masks, continually practice social distancing, continue to avoid large gatherings, and do not forget to frequently wash your hands. We must not let our guards down. We must continue to take the necessary precautions as we work to limit the spread of this deadly virus through vaccination and national vigilance. Let us continue to work together to make our country safe from COVID-19. And may God Almighty, the Lord of life, continue to bless and keep this great Commonwealth of the Bahamas. I thank you. CMO.
Good afternoon again, Bahamas. COVID-19 remains with us. We have made some progress over the last 500 days since diagnosis of the first case of COVID-19 in the Bahamas. We still have a long way to go, however, before we can say this pandemic is in our rearview mirror. The minister would have just updated you on the current status as projected here. I will now provide you with some trends. The slide you are looking at helps us to see that we are still on an upward trend. This time last year, after witnessing the short-lived zero no-COVID cases after the end of the first wave, many of us watched as the cases just continued to rise, praying that public health measures and other mitigation measures would bring a fast end to our new reality of illness, death, and enhanced restrictions. This reprieve, however, did not come for months. In late October, a declining trend became evident, and by early December, it got better, just for a time. And at the end of Epi Week 28, which ended July 17th of 2021, we find ourselves now with a 49% increase in new cases over the previous week. We are currently in another surge. The unfortunate thing is that there is now COVID fatigue by all, healthcare worker fatigue, and some even speak of compassionate fatigue in our new reality. There is a lot of fatigue, this is unfortunate because we still have a ways to go. The fortunate thing, and this is a fact, is that we are not without additional tools in our arsenal. Vaccines have been developed and are becoming very much more accessible. Slide 5. When we look at the overview of the last 12 months, 7-day moving average line, this allows us to see clearly that over the last 4 epi weeks, we have had a clearly defined, disturbing, and concerning upward trend in new COVID-19 cases in the country. The 7-day moving average trend line, which you see in this graph, reflects a steep incline in the new COVID cases over the past 28 days. This has been likened to an airplane accelerating for takeoff. Adherence to and enforcement of our current public health measures is essential at this time. The addition of additional measures to control further spread, as you would have just heard the minister articulate, has become necessary. When we look at hospitalizations, we see an even further disturbing trend. Hospitalizations saw a 100% increase from 46 at the end of June to 92 as of yesterday. This, of course, is disturbing. And if you would recall, our COVID bed capacity was pegged at 100. We are at capacity. Not to mention human resources challenges such as nursing shortages across the health sector, public and private, superimposed on what we are dealing with. As in the global arena, however, the latest surges are resulting in more hospitalizations. A significant fact being realized is that almost 100 of the persons requiring hospitalization for COVID-19 have not been fully vaccinated. This is similar to what we are seeing here. Being vaccinated against the SARS-CoV-2 virus is reaping benefits, just as vaccinations have shown for decades. Benefits for vaccine-preventable diseases of childhood, such as measles, mumps, rubella, diphtheria, pertussis, tetanus, just to name a few. And in adults, we know about the pneumococcal vaccine in the elderly, we know about varicella, vaccine for chickenpox, and you get in your older ages, you get a booster dose, and we know about the seasonal influenza vaccine. These all have reaped benefits. The COVID-19 vaccine is reaping benefits. We strongly encourage you to review the facts. Speak with your healthcare provider about concerns and know that the regulatory process established in the Ministry of Health for allowing COVID-19 vaccines into country is very stringent, and this is to ensure the safety of our immunization supply. This is to protect our people. Getting a COVID-19 vaccination at one of our vaccination sites is safe. Next slide. This slide is just to highlight the death trends, which you can see has actually gone up. Even though I would say most recently, we had a report of a significant number of deaths on a particular day being reported out. What I think needed to be understood in that scenario is that we have deaths that COVID deaths or deaths of persons who may have had COVID that needs to be reviewed, and they will be considered as a death under investigation. When those deaths are reported out, they are not necessarily related to that particular week. As you can see in this slide, in Epi Week 28, which was last week, we only had 7 deaths. The week before, 5. The week before, 5, and the like. So for the last 4 weeks, we have had a total of 21 deaths. We must be, as we move forward with our reclassification, we will have to be clear, very clear in our communication, that those deaths are actually applied to the week in which the death occurred. Next slide. Okay, so now we're going to move on and show you some of the realities on our islands. These are the current islands at the bottom that we have real concern about. There is New Providence, Grand Bahama, Exuma, Bimini, Eleuthera, and Abaco. When we look at New Providence, we see this island continues to be the epicenter of our COVID-19 new cases. 361 of the 450 cases last week, or in Epi Week 28, that would be 80% of our new cases was on New Providence. When we look at the 7-day moving average for New Providence, this emphasizes the sharp uptick that has occurred most recently. And we see that we are almost, well, we are above our most, I would say, our most recent wave, and we are almost moving in the direction of what we had in October last year. If we continue without any measures, we will be back to that. When we look at Grand Bahama, our cumulative cases continue to rise. Hospital beds are at capacity, with 25 hospitalized as of yesterday. The 7-day moving average for Grand Bahama actually shows a similar picture of a steep increase over the last 7 days. As we move on to the next slide, Bimini and Cat Key. We continue to have ongoing cases there, but we see where our mitigation measures seem to be making a difference. The 7-day moving average appears to show that there is some stabilization and somewhat trending down. However, we have to keep a close eye on that island, in part because of what our reports of ongoing persons in isolation and quarantine that are now converting to cases, the quarantine cases. On the island of Eleuthera, what we see is that there is an upward tick toward the end of the last 2 Epi weeks, completed Epi weeks. Of significance, we are monitoring this closely because these are clusters all across the island. So this island is definitely on the radar. The 7-day moving average suggests a possible stabilization and a downward trend. However, this must be monitored closely. Exuma shows a similar trend as Eleuthera, and those clusters are being monitored. Same Abaco. When we go to Abaco, we see no clear concern there at this time, but the 7-day moving average is suggesting that we may need to monitor that island even closer as well. So as we continue to monitor our islands, we must remember that while New Providence and Grand Bahama has the majority of our population in the Bahamas, certainly the hospitalizations, when we think about hospitalizations, we have to bring persons in from these islands regularly, and we have to ensure that those islands are monitored closely to try and decrease the spread of this virus, because that will definitely increase the burden on our healthcare system, which is already maxed. Let's move on now to vaccinations, just a little bit about it. The minister would have updated you regarding the total number of vaccines that would have been distributed thus far. This slide pretty much just depicts that. The orange portion of the bars actually speaks to the second doses, while the blue is first. And as you can see, we have moved way up the road as it relates to second doses. And the last 3 bars reflect a decrease, and that is in part due to challenge with access. But we anticipate that once we get the additional vaccines in country, we will move quickly to ensure that our persons are vaccinated. The next slide just shows us that we have had a good response as it relates to persons who would have actually come out to receive their second dose. The percent of second doses received is 85%. This slide just gives us a little insight into the age groups. And what we see here is we have a large number of persons who are under 60, 65.3% who have been vaccinated. Recall when we started with the older, well, the 60 and above age group. And this was because we knew that was the population that needed to be protected early on. But as we opened up, the younger age groups have been coming out to be vaccinated, and this is very encouraging. So we look forward to that trend increasing as we move forward with the provision of additional vaccines in country. This slide is kind of busy, but it was just to give an idea of where you see as we moved along with our vaccination campaign, the people who would have had the first dose, remember, see where it started in the orange line? Initially, they were higher, and now we are at a point where that line have crossed, and people with first and second doses has actually moved above. And the red line, it just speaks to people with at least 1 dose. Certainly we are seeking to move in the direction of ensuring that we have more those persons actually have the second dose. When we must talk about vaccination hesitancy. Public health officials agree that successful vaccination campaigns are a cornerstone for reopening, and are concerned with the countries with high access to vaccines are hitting an inoculation plateau. That would mean that countries who have full access to vaccines are now seeing that persons are not continuing to show up to be vaccinated. And there is the belief that some of this relates to, what we refer to as vaccine hesitancy. It is understood that the issues around hesitancy are, they vary, and it can be complex. But what we have to remember is that the only way out of the pandemic is to have enough persons vaccinated. And for us to get there, we need to have 70%. That's the number that we have always sought to at least have 70% of our population vaccinated, and that's at the global level. So we would need to continue to address concerns, and we will need to continue to ensure that access to vaccines continues to increase for countries such as ours. Next slide. Another concern that is adding fuel to the fire of COVID-19 is I would say, the emergence of various variants. We would have just said to you that we know that the Alpha variant was circulating in country based on those samples that were sent out for sequencing. While we cannot say to you concretely that the Delta variant, which is much more infectious, which I believe it has been demonstrated that one person is able to affect as much as 6 people. This variant is the dominant variant, or it certainly is very prominent in the US, and with our proximity to the US and where we are, with people moving back and forward, we cannot concretely say to you that it's not already in country. So this gives us another reason why we are strongly recommending that persons avail themselves of vaccinations as soon as they are fully available. And what we remind is that vaccinations, some people I think they are hesitant, they want to wait and see how well the vaccinations perform. But what we are seeing now is these vaccinations are actually protecting against not only the original SARS-CoV virus, but there is a level of protection against variants as well, inclusive of the Delta variant. So what we will say to you is that vaccinations is your best defense against illness, severe illness, hospitalization, and death from COVID-19. We would also say to you that the other public health measures that are proven, such as mask wearing, sanitization, and distancing, they should also be continued during this period. Until we have herd immunity, we are still at a risk, particularly our vulnerable people, our vulnerable age groups. And that includes the younger age group, where the vaccine is not available for them as yet, as well as persons who, for a number of reasons, cannot have the vaccine. So we have to protect each other, and we must remember, while there is individual choice, we live in a community, and we have responsibilities to each other to ensure the safety of each other. With that, I thank you, and we open the floor for questions. Theodore Seeley.
Hi, good afternoon.
Good afternoon.
Earlier this week, we were told that vaccines would be in country by Monday or Tuesday of next week, and now today we're hearing that they won't be on island until possibly the first week in August. That represents another 7-day delay. Are we currently in a state of crisis as the vaccination campaign continues to experience these hiccups? And what measures are being taken to shore up sufficient vaccinations being on island for your vaccination campaign, considering that officials continue to harp on the fact that vaccination is the only way to beat this pandemic?
Thank you for your question, a very good question. And you are correct, it is a further delay. We would have actually been notified just, I think, late yesterday evening that the third tranche of COVID-19 AstraZeneca vaccines will not be here until possibly early August, which is a week or so away. We were hopeful that they would be here on the 26th, but As it relates to the COVAX facility and global supply and having to provide vaccines, that is these are some of the challenges that we are having to face. We are not a vaccine producing country. We went through the COVAX facility to seek to be a part of that global mechanism that it was to ensure equitable access to countries. And we continue to work closely with the Pan American Health Organization to ensure that we are as high on that list as we possibly can be. This is unfortunate, but to the second part of your question, there have been a number, the National Vaccine Consultative Committee in particular, would have sought on behalf of the government of the Bahamas to source vaccines from many in our region, many out of our region. So we are seeking as best we can to fill that gap. And as the minister would have communicated to you a few moments ago, we have a number of vaccination I would say, options, opportunities on the horizon, and we are working with CARICOM, with CARPHA, with all agencies to see how we can best, even COVAX, to see how we can best shore up our vaccination supply. And I would say that certainly what we are, I truly believe that once we have the AstraZeneca in country, shortly thereafter, definitely in the third quarter, into the third quarter of this year, we will be getting additional vaccines and options as well. So it is unfortunate, and we certainly did not wish to be here, but we are aggressively moving toward getting sufficient vaccines in country. And we look forward to persons actually availing themselves of these vaccines when we get them here. Leandra Roll.
Hi, good afternoon. My first question is regarding the variants of concern. Based on the fact that variants have been detected in country, I want to know if there are any plans underway to secure the genomic sequencing tools that are needed to determine which variants people have been infected with. I know the health minister would have mentioned that earlier on this year that officials were looking at ways to secure the tools. And also, could he say how many samples would have been sent abroad to determine that as well?
Okay. Minister, you want to? I have Dr. Martin. Okay. I have Dr. Indira Martin from the National Reference Lab here. She would be best suited to speak to that question.
Hello, good afternoon. Certainly the prospect of adding genomic sequencing to our test menu here at the National Reference Lab is something that we're considering based on the rapid evolution of these variants. So that's something that we're looking at. But the thing that has to be remembered, of course, that the priority at this time is to detect COVID cases, no matter which strain of COVID it is, because it's something that we can actually do about that. We can quarantine persons who've been diagnosed as COVID positive. By contrast, the knowing which variant you have is more of a public health question at the surveillance or population level versus the individual, the level of the individual well-being. So from that perspective, it's a different level of priority. It's still very important information, but all of these things will have to be weighed as we go forward. For the time being, we continue to rely on our trusty partners at PAHO, in particular the Theo Cruz Lab, which is allowing us to, we initially started with providing a quarterly review of the strains in the country, but we are now probably going to increase the frequency with which we actually send off those samples. And I anticipate that that should basically help us to meet our needs in terms of the surveillance at the population level of variants of concern and interest. But we continue to monitor the situation, and if needed, we may need to expand those services. Thank you.
Thank you, Dr. Martin. And certainly what I would add to that is exactly what she would have alluded to. In a public health crisis as we are in, it's good to know what we have circulating. However, we are well aware of measures that control the spread. And certainly we advocate strongly for persons to follow the public health measures to minimize the spread of any variants which may be here. But we will continue to move forward with that sequencing so we can determine exactly what is in country. Jasmine Brown.
Good afternoon. Obviously, the data that we got today shows that we are indeed in a public health crisis. However, earlier this month, the policymakers had let us know that they're not looking to extend the state of emergency in mid-August. Are health officials going to recommend not extending it, since we are clearly in a pandemic still?
Well, should the EOC be tasked with, that consideration, we will make an appropriate recommendation. I don't know if Minister wished to expand.
Thank you so much, CMO. The reality is that the government of the Bahamas listens very intently to the recommendations of our health professionals. We take those recommendations and we put them through the prism of the recommendations in regards to the totality of our national reality. And so when we look at where we are and where we're seeking to go as a country, we make the decisions based on the recommendations of our health professionals. And so even though the emergency orders expires in August, obviously August 13th, we will be looking at where we are as a country, and the political directorate will then make decisions as to what we do beyond August 13th.
Thank you, Minister. Cleopatra Murphy.
Good afternoon. The Prime Minister told reporters earlier this week that government is in discussions with cruise lines about taking Bahamians to the U.S. at government expense to get vaccinated. Now, that sounds to me like a super spreader event waiting to happen, especially with cases now surging and the possibility of the Delta variant being here. Now, we know that people can test negative one day and the next day test positive. So from a public health standpoint, is this something that government should realistically consider?
Certainly from a public health standpoint, we will have the opportunity to review what is being proposed as it relates to, that kind of event. The suggestion that it may be a super spreader event, I guess that is so. However, if the necessary public health measures are actually implemented, there is a possibility that we will not move in the direction of a super spreader event. I believe that recommendation just related to where we are as it relates to seeking to get our population immunized. And it is frustrating that we are where we are, and we wish to actually have a significant component of the population immunized. But long and short, as with the previous question, the EOC of the Ministry of Health, we deliberate on these matters, and we provide the best public health advice. And when required, we even seek outside advice. So we will not nilly-willy support an event that would be a super spreader event. Tyler Simonet.
Hello, can you hear me?
Yes, I can. Thank you.
Oh, good afternoon, everyone. Um, I know that Minister Wells mentioned that many nurses are leaving due to seeking better benefits, and head of the nurses union, Nurse Samantha Williams, has said that a number of nurses are out due to COVID-19 exposure, and they're very overwhelmed at this time. Is the ministry looking into giving these nurses more incentives and benefits to stay in country to fight this pandemic with us?
Minister?
Thank you, CMO. The government of the Bahamas seeks to do everything within its power to seek to retain our healthcare workers, our professionals in every sphere and in every sector. We are looking as to how we can seek to keep not just the nurses, but the doctors here at home. Interestingly enough, you've mentioned the fact that a number of nurses are out having been exposed to COVID. I just want to offer condolences to the family of nurse, I think it's Eldora Poitier, who died on Wednesday from COVID-19 at Doctors Hospital West. She was a nurse in the maternity ward at PMH, and so we want to offer our sincere condolences to her family. Again, the government of the Bahamas, we are encouraging our people, our healthcare workers to become vaccinated so that we can move beyond where we are to where we want to be as a country. But you know, this administration has been seeking to incentivize our folk in many ways. We are looking at giving, well, not looking at, we will be giving an honorarium very, 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 very soon to those who have been on the front lines. We have a death benefit for those who would have passed away in the course of battling this menace of COVID-19. And I think the general public, the healthcare sector can stay tuned as we deliberate and commiserate as a cabinet on what we can do to retain our people here in country.
Karen Bain?
Good afternoon, Minister. Good afternoon, CMO. Good afternoon, everyone. My question is in regards to piggybacking off of Zeleness about the super spreader. I understand that there was no particular event. Could the sudden rise in cases for Grand Bahama be attributed to travel?
I believe we have Dr. Frank Bartlett.
Good afternoon, everyone. As it relates to travel being the main factor for the increase that we're seeing much less of our positive cases being attributed to travel. We're seeing more of persons actually within the Freeport area being affected, and we're also seeing cases in as far to the east as Deadman's Reef, and also in the east end of the island, that's Hiwa. And when we look at the data and the persons who are now becoming positive, their tests are testing positive and then becoming symptomatic and appearing to the hospital or accessing care to one of our facilities here in Grand Bahama. We haven't had any type of direct correlation as we would have had in the past with persons who travel. So that is one thing that we are being vigilant on right now. Over.
Yeah, I can't, he's answering me, but I can hear him.
Thank you, Dr. Bartlett. And certainly I would add to that, that we in the surveillance unit, New Providence, we monitor imported cases, those linked to travel. And in reviewing that data, there was not a significant number of imported cases reported. We regularly monitor that, so for the Bahamas, actually. Royston Jones.
Good afternoon, everyone. I believe the government had indicated that it was seeking to borrow around 20,000 doses from St. Vincent and the Grenadines. Can the minister perhaps give an update on how we might be acquiring those and if that deal is coming through from them or any other Caribbean country?
Minister.
Again, thank you, Ralston, for the question. We continue to seek to obtain vaccines from wherever we can in regards to ensuring that we adhere to the WHO's protocol, that we know the chain of custody as to where we get it from. And yes, we are in discussions with other Caribbean countries, and we're seeking also to see whether or not we'd be able to source vaccines. As you mentioned, we had spoken to St. Vincent and the Grenadines, and there's still an ongoing discussion. But as I would have said during my contribution, we are expecting in country during the first week of August the 33,000 doses of AstraZeneca vaccine. And we're also looking forward to receiving vaccines both through COVAX and through the Caribbean portal, 2 groups of vaccines, one from the African platform, which we are a part of, which we've paid a down payment on previously for Johnson & Johnson. And so between all 4 of those tracks, we're going to be receiving vaccines very, very soon in country, and we're going to be able to give the Bahamian people an opportunity to have at least 3 different types of vaccines in country that they would be able to avail themselves of.
Thank you. Christina Dragovich.
Good afternoon. The minister touched on this just toward the end of his answer just now, but when those other COVID-19 vaccines are available in country, will Bahamians be given a choice of which COVID-19 vaccine they get?
Minister, did you want to take that? Oh, I'll go ahead. Okay, the question is whether or not individuals will be given a choice. We anticipate the availability of the 3 that Minister mentioned, and we anticipate that, you know, there will be opportunity for persons to avail themselves of what is the vaccine that will be available in country at the time. We have a platform that we currently use for persons to go online and actually make their appointment. That platform can actually accommodate different vaccines. But right now we only have the AstraZeneca. Once the others are in country, you go online, make your appointment, and you can actually look at, you know, which site is offering which particular vaccine and make your choice accordingly. So I guess that's a long way to say options will be available and persons will be able to choose based on what is actually being distributed at various sites. Rachel Knowles.
Good afternoon. Minister Wells acknowledged earlier in this press conference that the fully vaccinated can still spread COVID-19. PAHO officials have also repeatedly recommended against using proof of vaccination as a prerequisite for international travel. With that said, what is the justification for not requiring PCR or some type of COVID testing for all people entering the Bahamas?
Minister.
I think it has to do more with the risk profile and the assessment of the risk. And so obviously those who are vaccinated, though they can still contract COVID, I believe that the likelihood of them contracting it is much less probably than someone who is not vaccinated. At the end of the day, we are going to continue to have in place the antigen test. So once you come into country, if you would have stayed beyond the 5 days, you're still required to take the rapid antigen test so that we can avail ourselves as to whether or not you are positive for COVID.
Shamarko, Lightborn.
Hi, good afternoon, Dr. McMillan. It's Marco Lightborn from the Blaze 98.3 FM in Exuma. Perhaps this question is well suited for Dr. Bartlett if she's available. Can you offer the geographic map showing the points of concern for the Exumas, just so that our residents may traverse more carefully, and an update on the progress of contact tracing in that area as well?
Dr. Bartlett is available.
Good afternoon, all, and good afternoon, Bahamas. So the update for Exuma as of today, we have a total of 30 active cases in Exuma with 1 death. We have on our mainland, as it stands now, 19 cases, PCR, and 11 for the rats. Out of these cases, we have 17 on the mainland. Sorry, we have 19 on the mainland, and the others are distributed among the keys. We have 1 in Fall Key, 1 in Staniel Key, and we also have 1 in Black Point. So that is the distribution for Exuma, the mainland, and the keys. We are actively now have 59 persons in quarantine that are also distributed, with 48 being in the mainland, 17 on Staniel Key, 2 on Fowl Key, and 2 in Black Point. Contact tracing continues in these areas as we continue the fight against COVID-19 in the Exumas and along the archipelago of the Bahamas. Thank you. Over.
Thank you, Dr. Bartlett. Shamarko, you have a second question?
Yes, thank you very much, Dr. McMillan. With the hospitals being at capacity in the nation's capital, what's the plan for the Exumas? Should we have numerous persons needing critical attention or the use of a ventilator and so on? When we look at the limitations of our current healthcare system on the island and compare that with the influx of visitors for the vacation season, as well as us being a new cruise line port of call and a growing population, it's just a very growing concern. Should we have the misfortune of critical cases, but difficulty with the immediacy of how we can treat them?
Thank you. Very good question. Certainly, this highlights the need for balancing the opening up of our economy with our capacities. When you ask about Exuma in particular, certainly you have a facility there that is fairly well equipped, but yes, persons may need to actually be airlifted out. We seek as best we can to accommodate persons having to come out of the family islands for another level of care. Now, with the current situation that we have, that sometimes require a lot of dialogue, a lot of back and forth between PMH, Dr. Bartlett, Dr. Burnett, Ms. Walker. But what I think the most important message here is, as we move in the direction of the opening up and those activities occur that you would have alluded to, it is very important that the public health measures such as wearing your mask, distancing, sanitization, all the time, they are actually occurring, because the risk of spread or the risk of transmission is there. So I don't know if Ms. Walker or Ms. Dr. Bartlett wish to add, Jillian Bartlett wish to add anything to that response. Dr. Bartlett?
No, CMO, just to add to what you, or concur with what you have said. When we do have these cases, we try our best to manage them in Exuma or any of the islands where this challenge may present. And we try to work closely with our partners in New Providence, which would include our major hospitals, be it Doctors Hospital West, East, and our main hospital, PMH, along also South Beach. We try our best to get these patients in, because we realize the longer they stay out there, they're at a deficit, and we have to get them in quickly for best outcomes. So we try our very best to get these patients into tertiary care. Over.
Thank you, Dr. Bartlett. And certainly, as we move back around the family of islands with vaccinations on availability, we encourage our family island residents to avail themselves of the vaccination. They've done very well as it relates to availing themselves. So we'll continue to seek to increase the coverage, immunization, the COVID-19 immunization coverage on family islands. Rachel Knowles, do you have a second question?
I do. My second question is, we have been seeing cases increase steadily for the past few weeks, cases, hospitalizations, and possibly deaths. Why has it taken this long, where healthcare workers are already saying that, you know, the hospitals are at capacity, the healthcare system is stretched extremely thin, for new restrictions to be implemented as opposed to before it got to this point?
I'll let Minister take that question.
I believe that if you look at the graph that was shown by the CMO, you will see that there was a second wave, and as we went into March, the numbers began to increase, and as through April, May, June, then the numbers began to tip down. As we encourage the Bahamian people to adhere more to the health protocols. And so government was observing the trend, listening to the recommendation of health professionals, and the reason why we are here today and seeking to address the issue in the manner in which we've addressed it is because that downward trend has taken an extreme trajectory now. And so we do not desire for that trajectory to get out of hand in the way that it could potentially get out of hand. And so we're seeking to address it now based on the data, based on the numbers that we would have seen. Our desire as an administration, as we look, as we encouraged, as we all collectively together, the Bahamian people, the community, we were all together seeking to bring down the cases, and we were doing a fantastic job with the trend. But now the trend is trending upward, and we are looking at the data. There is the suggestion that we may have the Delta variant. We're not we're not certain about that, but as we've spoken to the National Reference Lab, we have sent some samples off, and we're looking to get those results back. But we are acting responsive and responsibly, given that kind of slope that we see on that curve.
Christina Dragovic, second question, please.
Hello. Yes. Can we get an update or an overview of vaccination rates among doctors, nurses, healthcare providers, as we know they're on the front lines, and they may also be infected with COVID?
Minister is reminding me. Certainly, I do not have the latest percentage for that group. We looked at it a few weeks ago, and if I recall, I think we were around, I can't remember, but we were about 50% of the grouping, the healthcare grouping. I do not have the exact percentage now, but certainly, you know, there is we recognize the need for that grouping to be on board with vaccinations. And in our discussions, I would say deliberations of the EOC, as the health EOC, a recommendation would have been put forward for, you know, consideration of mandatory vaccinations for healthcare workers because of the significance of that group. Now, there are other things that must be considered because that grouping is the grouping that actually influence whether or not others actually, you know, we recommend that you have a conversation with your healthcare provider So we have to work closely with the healthcare provider grouping to understand their concerns, and also to understand, what, even if they have a concern with being vaccinated, what is the difficulty with, making the recommendation to others to be vaccinated. As I alluded to in my remarks, the hesitancy across groups is a complex thing. And certainly the Pan American Health Organization would have done a survey of healthcare workers, and the findings of that survey suggest that we need to look at a multi-pronged approach to be able to engage the grouping and understand the concerns and begin to, decrease the likelihood of them not being vaccinated, as well as increase their likelihood of recommending the vaccination to others. So that's something we're working on now, and I'm sure we'll be in a position to update. Royston Jones.
Afternoon again. When PAHO confirmed on Wednesday that global data was available on the Bahamas' variants, I think Genomic Surveillance Regional Network said that there was Alpha and Iota confirmed in the Bahamas, and that data had been available for quite some time. Why did it take an international body to confirm that to the public and not the government to advise on variants? Although I know that affects policy. Why didn't the government confirm that earlier? And when did we get those results back?
Okay, so those results, I believe they would have come into country late, I think sometime on the weekend or early this week. We had scheduled this press conference for Wednesday, I think, so the intent was to bring it forward at that time. The network, I think, that you are referring to, that they automatically put those up, and certainly there is a requirement for the Pan American Health Organization to notify through the International Health Regulations portal, seek the countries, I would say, to ensure that the country is notified. That came in, I think it was Wednesday, and we would have sent forward our response to them, saying that yes, we became aware of it. Now, ideally, you would want it to go out immediately that night. It did not occur in this instance, in part because the intent was to actually do it at the press conference, but that is something that could be revisited, just to ensure our people are aware of what is happening prior to finding it out in the international arena. Karen Bain, second question, please. Move on, okay. Tyler Simonet.
Good afternoon again. I understand that due to these uptick in cases, Minister Wells just gave us an update on restrictions, but can health officials tell us if the country or any particular island is on the path to a full lockdown? Is that something health officials would be recommending at this time?
Minister, did you? Oh, I could speak to the health official side. Certainly we deliberate every week regarding, where we are, and certainly we send them forward for consideration. Full lockdown is, always a consideration if we had, for a consideration of recommendation. If we believe that that would be the way and the only way to, I would say, get our hands around what we are in. A full lockdown, definitely will, well, I wouldn't say definitely, but would more likely get your hands around things, but there are also considerations around a full lockdown as it relates to where our country is. So we make recommendations. We actually have a list of recommendations that we send forward for consideration and deliberation. I believe my minister would have communicated to you what the decisions are that were taken, and we will move forward with those and continue to monitor the impact. And certainly, we monitor these things on a daily basis, and we have ad hoc EOCs all the time. And should that be necessary, we will make further recommendations. If that would mean a lockdown, we will have to do it. Cleopatra Murphy?
Okay. I know we are not where we need to be yet in terms of adult vaccinations, but is there any possibility that vaccinations will be an option for children this year?
Certainly I don't know if this year, but I know there are studies that are actually occurring already as it relates to the younger age group for certain vaccines. I know Dr. Archer is here. I'll ask her to speak to that. She has been working very closely with that aspect.
Hi, good afternoon. As it relates to vaccines being available to children, adolescents, at present, the Pfizer vaccine is the only vaccine that actually has an indication for children. So whenever the Pfizer vaccine is in country, it'll be offered to the age group for which it is indicated. Thank you.
Jasmine Brown.
This question is for you, Dr. McMillan. Prime Minister Minnis said earlier this week that the vaccinated are out of a pandemic. Do you agree with this statement, and what is the evidence of such?
I think you were referring to that state that, I wouldn't know if it's a hashtag, but that is commonly used now. It's the pandemic of the unvaccinated. To a great extent, that statement is true, in part because the vaccination protects from severe illness, hospitalization, and death. What does that mean? That means that receiving the vaccine decreases the likelihood of you having a severe form of COVID, even if you are infected with COVID. Persons who have been vaccinated can, yes, get the infection, but more and more studies are coming through to show that those persons who have been vaccinated are less likely to have severe illness, hospitalization, and death. Now, I know Dr. Forbes is here. I would ask her to speak to our reality.
Good afternoon, and thank you for the request. And so I can share that the data from Princess Margaret in terms of our hospitalizations and deaths, there are no persons who have been fully vaccinated against COVID-19, and that is persons that have received 2 doses of the AstraZeneca vaccine or another comparable vaccine and have had their full doses of that vaccine, have been hospitalized at our site or died. And so more than 98%, it's actually about 98.3%, have not had any vaccinations. And a smaller number have had 1 dose of their AstraZeneca vaccine, and all got COVID less than 14 days after getting that vaccine. And so certainly that supports the global information that getting vaccinated will protect against hospitalizations and deaths. However, COVID that is spreading anywhere, globally and here at home, is a problem for all of us, because with the healthcare system being over capacity, there is a lot of diversion from other services like elective surgeries, clinical care, routine testing, and disease surveillance and screening. And so there is fallout from that. And so it is all of our problem. But as it relates to the actual scientific information, if you get vaccinated, you will be largely protected from hospitalization and death.
Thank you, Dr. Forbes. Leandra Roll.
Hi, good afternoon again. My second question is perhaps for Dr. Bartlett. I know officials would have said that they see no major concern for Abaco as it stands, but are closely monitoring the situation. But recently there would have been reports of a COVID-19 outbreak happening on one of the keys, particularly Hopetown. Are officials able to provide more information on what's happening on the grounds there?
Dr. Jillian Bartlett.
Good afternoon again, Bahamas. So I'll present for Abaco so we get a picture of what's happening there. We have a total of 52 cases distributed throughout Abaco, with 62 persons in quarantine and 10 persons under investigation. It has come to our attention that yes, in Hopetown, where we have 29 of those cases, that there was an event at one of the restaurants there that they had an event on both the 4th of July and now again on the 10th of July. And we are seeing cases as a result of those events from staff and contacts of staff. So the healthcare team actively is monitoring that situation with our contact tracing and ongoing medical assessments. Thank you.
Thank you, Dr. Bartlett. Theodore Seeley.
Hi, good afternoon again. My second question, hospitalizations are at their highest levels as we're now in the third wave of the COVID-19 pandemic. In addition to the temporary tent that's been erected outside of PMH, what are the plans on the road ahead for increasing bed capacity, as it would appear that the healthcare system is under collapse as trends are significantly surging?
Okay, I'll ask Ms. Walker or Minister.
Good afternoon, and thank you for the question. Indeed, the surge has placed a serious burden on the health system, and in particular, Princess Margaret Hospital. Today, even as we were in this press conference, our numbers grew to 50 positive patients at that facility. And indeed, it is a burden now for us to find the space for those additional 10 persons who cannot be accommodated in the special pathogens unit or the legacy unit. We are making our best effort in conjunction with some engineers to see if we can, as best we can, ensure that there is a negative pressure measure put in place either on one of the existing wards or even if we have to resort to another tent availability. There are about 3 options on the table that we're considering at this very present time. I cannot say enough that persons are presenting at Princess Margaret Hospital with the severe form of COVID disease, and they do require hospitalization. And on the other hand, the healthcare providers are getting very, very exhausted at this point in time. They are encouraging one another, but this is a grim situation for us as the healthcare providers. And so if we say one thing to the public, please recognize that the public health measures will keep you safe. Social distancing, washing your hands, making sure that you wear your face covering, and indeed we encourage you to get vaccinated because it is one of the tools against this disease. Thank you very much.
And just to buttress what Administrator Walker would have spoken to the government of the Bahamas, we are, as she rightfully pointed out, we're looking at about 3 different options. We are seeking to expand the opportunity for, as she would have said, negative air pressure inside of a number of space inside of the hospital. We're looking at putting ultraviolet light inside the air conditioning system, MERV 20 filters to be able to ensure and secure the health of the healthcare workers as well as patients. And we are looking at mobile options for the government of the Bahamas should we continue down this road. And so I think the Bahamian people can understand that we have taken this very seriously, as we always have, in seeking to ensure that we can provide the services for them throughout the course of this pandemic. We have moved forward in looking as to how we onboard additional healthcare persons, doctors, nurses, those who are retired. The government of the Bahamas is bringing on additional personnel to deal with our current situation and any potential increase in our current situation.
Thank you, Minister. And with that, those comments, we have come to the end of this Ministry of Health COVID-19 update. Before we sign off, I want to thank the health team that came today to actually be available for the press conference. That would be Ms. Walker, Dr. Swan, Dr. Archer, Dr. Brennan, Dr. Forbes, Dr. Martin, Drs. Bartlett, that's Jillian Bartlett and Frank Bartlett. And I also want to thank the wider healthcare team for their ongoing support to the COVID-19 response. And thank you, the Bahamian population, for tuning in to get this update today. I wish you a wonderful weekend.